Well, good afternoon, everyone. Thank you very much for taking time out of your busy schedules and joining this presentation, which is all about speech recognition and how speech can improve the quality, the speed and the turnaround of clinical documentation. Let me introduce myself. I'm Simon Wallace, former GP in years gone by, and been in the digital health space for the last 15 or so, and been Nuance's CCIO for the last 4 years. I'm going to cover a number of areas over the next 15 minutes. I'm going to just look at the complexity of healthcare and what that's meant for clinical documentation, and ask the question whether digital technologies such as speech recognition can help here. Provide some case studies where speech has been used to good effect, and then round off by looking into the future of how this technology can create what we call the clinic room of the future. So let me start with this wonderful quote from Sir Cyril Chandler, way back in 1998, actually, but he stated, "Medicine used to be simple, ineffective, and relatively safe. Now it is complex, effective, and potentially dangerous." And that's no truer than what we've experienced over the last 4 or 5 months with COVID, and how the symptomatology's changed, the treatments have changed, and it really emphasizes the need for quality, detailed documentation. Now, we've come a long way from the paper-based records, and particularly in the primary care world, EPRs have been the vanguard of this way forward with documenting. But needless to say, we did a survey several years ago where we were trying to understand how much time in a clinician's day is actually spent creating documents. And for doctors, it's around about 11 and a half hours per week, slightly less for nurses, which is really quite something. And you combine that with then almost 1 in 3 doctors being burnt out or stressed. And it's not surprising, I guess, that clinicians are just overwhelmed and demotivated by the excessive amount of admin that's required in the day-to-day activity of our roles. So it begs the question of whether digital technologies can play a role. And I'm going to talk about speech recognition. And before I do, I thought it might be useful for me just to sort of articulate what I mean by speech recognition. Unlike digital dictation, where you might speak into a recorder and a tape goes to a secretary for typing, this is where you speak into a microphone, and that speech actually turns into text at the point where the cursor is. That cursor might be at a certain part of the electronic patient record. It could be in a Word document, it could be your email. It doesn't really matter. It's where the point of cursor is, that's where the text will actually show. Now, it's much faster than typing. We speak 3 times faster than we can actually type, so it speeds up the process of documenting. And today, its accuracy is at industrial strength, and there are a number of reasons for that. One is the deep learning and the AI-based algorithms that sit within the speech engine. And secondly, there's a comprehensive medical dictionary that sits behind it that now allows the recognition rate to be very, very high indeed. Those of you that have used speech in the past, you may have actually had to train the engine. Well, that's all gone away now, and mainly because the algorithms are sophisticated that you can now use it straight out of the box. And I think the other key component is the fact it's cloud-based. And that has a whole series of benefits attached to it. So you as a user will have your single voice profile. And by being in the cloud, you can access that from wherever. You're not actually tied to a workstation. So for example, in primary care, you might be at your satellite clinic, and you simply access the speech by signing on, and it all going through the cloud. In the hospital setting, you could be moving around from room to room in a clinic, or in theatres, or wherever. And with all the appropriate security, that can also be accessed in the home environments as well, should that be required. You can also use macros in the same way that you probably use them in an EPR if you're using that at the moment, but these are voice activated. And how to get the speech into the record, you can either do it with a tethered microphone, which I'm holding up here, or on the right hand side of the screen, there's an app you can have on your smartphone, which you can equally use as well. We've found that clinicians have found that very useful indeed. So, does it work? Well, I thought what I'd do is give you some case studies from some different clinical settings to demonstrate some of the feedback and results that we've had. And let me start in primary care. This was one of our partners, Voice Technologies, was involved in working with this practice up in Scotland, and they'd used analog tapes previously for dictation and then secretaries typing up. And they then moved to Dragon Medical One, and Dragon Medical One is the cloud-based solution that we provide. And the overall output was that the generation and the distribution of the correspondence was much, much faster, with the GPs actually generating the content themselves using speech. And particularly over the last few months with COVID, one of the staff there felt that using speech was an absolute godsend, because it allowed saved time to allow much more effort to be put in for delivering time-critical tasks. A couple of other examples in primary care. The Waterloo Medical Group had a lot of backlog and were getting a lot of outsourced work and needing to pay for that. By the clinicians using speech, that actually saved them money over time. And at Wellspring Medical Practice, they felt that the quality and the accuracy of the content of the letters by the clinicians using speech was much improved. And I think we'll be able to distribute the slides, and you can see some links there to case studies where you can read about that in a little bit more detail. Let's move into the community side of things, and this is in Cambridgeshire. A group of physiotherapists who their secretaries were, they saw patients on behalf of GPs and were needing to do letters, and they were way behind in getting those letters done and out, something like 6 to 12 weeks. And the physiotherapists started using speech recognition to create their letters. And their turnaround time for letters reduced dramatically down to about 2 to 5 days, reduced their backlog. And certainly from them, and we've certainly found with clinicians in other settings, it allowed them to go home on time without having to do a lot of this admin work outside sort of traditional working hours. Moving to the acute sector, again, 2 large NHS hospitals, one in London, one in Oxford. You can see from the slide here, very high number of letter creation each year. They were missing their CCG targets for getting the outpatient letters to the GP. And they had some admin staff shortages of sickness and vacancies. And they also had high outsourced transcription costs. And the clinicians were often having to stay late to do their admin. Both organisations introduced a paperless outpatient letter workflow, and they noticed that one of the outcomes was their turnaround time for letters was reduced from 17 days to 2 to 3 days. And that 2 to 3 days was often because the clinician was waiting for some results to come back from the laboratory that he or she wanted to include in the letter. But sometimes if they weren't required, the patient was leaving the clinic with their outpatient letter that same day. And from the primary care perspective, the GPs were receiving those letters in a much more timely way. So if the patient had some problems and went back to see them, the communication was much more seamless and robust. These two trusts had financial savings because of reduction in outsourced digital dictation, and also some internal staff costs. They had a lot of bank and agency staff that they had. And from the clinician's point of view, they felt there was a better level of care and less catching up on paperwork after the clinic. And likewise, I've put a link to the 2 case studies there that you can look at your leisure in the days to come. Let's move into ED. This was a piece of work done with EMA's Symphony, where clinicians were, instead of typing or doing some digital dictation, they were doing their notes directly using speech recognition. There was a general time saving of around 40%, which averaged out to about 3.5 minutes per patient, which was the equivalent if you amortized up all the patients seen in that ED over a period of a year, with all clinicians using speech, to around 389 days, which is really quite something. The clinicians overall felt that it saved time, it reduced delays, and improved the flow of their communication. And they felt that the quality of the note they were generating was also much improved as well. And then finally, in mental health, again, similar findings. I think the thing that was interesting here, as well as reducing backlog and faster turnaround of documentation, was that they noticed that their adoption of the EPR was much increased by using speech. And there's a lovely YouTube clip, which I've given you a link to, which this particular organization created about some of their experiences of using speech recognition in this particular setting. So that's all well and good. I'm sure some of you may have seen this picture before, but this is a painting by a 7-year-old girl to her clinician. It's a US outpatient department, but she sent this after she had seen her clinician, and it was a very successful appointment. This is the 7-year-old girl. Here's her sister, I think with a glossy magazine, it looks like. Mum in the background with her baby daughter. And here's the poor old clinician hunched over his computer, filling all the details. And when the clinician saw this, he was really quite mortified that this had actually was the outcome, although it was a good interaction. So that's the foundation for speech recognition. I'd like to sort of just finish, if I may, with a little bit of a look into the future. Because if you have this as the foundation and you then add natural language processing, there's a whole load of other things you can do on top of that. You can, for example, use natural language processing to search clinical notes and possibly suggest some diagnoses that may not have been documented. You can improve the specificity of that diagnosis, and you can put a SNOMED CT code behind that. And you can have virtual assistants that, instead of clicking around to access something within the record, you could say, for example, show me the last ultrasound report, and it will bring that up on screen. And then it comes full circle to what we call ambient clinical intelligence, the clinic room of the future, where the desktop, that desktop in that painting, disappears. And here you've got a wall-mounted smart speaker which is picking up the voice of the two people in the picture there. Voice biometrics distinguishes between them, and the whole conversation is diarized, and natural language processing then allows a structured, codified clinical note to be produced, all without the clinician touching a keyboard. So no typing, no clicks, no back turn to the patient. And I thought what I'd like to do is to finish off just by showing you an example of that being done in practice.
Welcome to the future of medicine, where ambient clinical intelligence creates a better experience by enabling care teams to focus more on patients and less on technology. Ambient clinical intelligence listens to physician-patient conversations while providing workflow, task, and knowledge automation, allowing clinical documentation to write itself, all within the EHR.
Hey Dragon, let's get started. What can I do for you today?
It's my right knee. For about the last 2 months, it's really been hurting anytime that I sit down or stand up.
Now, didn't we give you an injection in your left knee a while ago?
Yes, but I don't remember when that was.
Let's see if I can find it. Hey Dragon, show me the previous procedure notes.
Aside from accurately capturing every word, user-initiated virtual assistants help get information in and out of the EHR.
And where does your right knee hurt?
It's right here.
And integrated machine vision detects nonverbal cues to support even greater documentation
so it's better
accuracy.
when I'm sitting or lying down, but when I stand
Physicians
up,
speak
that's
naturally,
when it burns
and
inside
key
me.
information is translated into clinical terminology.
So you have tenderness over the inner joint line of the right knee.
Intelligent summarization turns natural language into
No
coherent
tenderness at the left
sentences.
knee and normal range of motion. I do feel some moderate crepitus in the right knee and mild crepitus in the left knee. Have you been taking any medication for the pain?
I have. I've been
Beyond what the physician says, relevant patient responses are added to the clinical note, eliminating the need to re-enter information.
Alex, my assessment is that the cartilage in your right knee is worn out.
Ambient clinical intelligence extracts problems as coded information that physicians can verbally accept and add to the problem
That
list.
does not sound good. Is there anything we can do?
For sure. First, let's start by
Orders are automatically identified and queued as pending. From here, the virtual assistant engages in a conversation with the physician to complete the orders and sign the note, further reducing burden and eliminating rework.
Quadriceps. And then in 6 weeks, I want you to return and see me. If you're not significantly better by then, we'll talk about doing a cortisone injection and getting an MRI of the right knee. Does that sound like a plan? Do you have any questions for me?
No questions. Thank you for all your help.
You're welcome. Why don't you come with me and we'll get you checked out.
So I'm going to stop there, but what I hope I've been able to do in this presentation today is show you the opportunities that speech recognition can offer clinicians in their busy work life. And with the email address below, please feel free to get in touch. I'm very happy to answer further questions that may not have been answered during the presentation today. Thank you.